Hi, my name is Durchana and I'm here for a new grad interview. How are you today?
I'm good. Thank you so much, Durchana, and welcome to the interview. My name is Ravina, and I will be taking your interview today. So, are you nervous?
I'm a bit nervous and excited at the same time.
Yes, so you don't have to be nervous. It's just the three easy questions, and you'll be fine. Okay. So,
Yeah,
if
looking
you do
forward.
not understand the questions, I can repeat the question as many times as you like. Okay.
Yeah,
Okay. So, are you ready? Should I start now?
yeah, I'm ready.
All right. Okay, so the first question is considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following situation? And the situation is it is your first rotation as a new graduate nurse in the cardiac unit. You responded to a patient call. When entering the room, one of your patient is short of breath and the other patient, who was diabetic, was feeling lightheaded and sweating profusely. How would you handle this situation? Do you want me to repeat the question?
Oh, no, I think it's fine.
Okay.
So, thank you for the question.
Mm-hmm.
So, one of the standards for practice as a registered nurse also includes thinking critically and analyzing nursing practice. If I was in this situation where both the patient need urgent care at the same time, as one of the patient is short of breath and another patient is diabetic, feeling lightheaded and sweating profusely, being a registered nurse, I'll be responsible for both of my patients, but it is impossible for me to be with the both patients at the same time. Here, I'll be using prioritization and delegation skills. As a registered nurse, I always have to remember on back of my mind that I'm not working alone. I am working with a multidisciplinary team. I will ask for help from my nursing staff to look after my patient who's diabetic, and I will attend to the patient with shortness of breath first because they can deteriorate very quickly. And it will be unethical for me to leave the patient with shortness of breath unattended for a long period of time. And also, it would be very distressing experience for the patient. And I will reassure the patient and also provide emotional support to the patient so that they do not exacerbate the shortness of breath, because some shortness of breath can be exacerbated by some anxiety or panic attack as well. So I will also reposition the patients and put the patient in high Fowler's or semi high Fowler's position. I will check the patient's oxygen saturation and give the oxygen if it is required. Then I will also do a set of ops, and if there is any abnormal findings and assessment, I will escalate the duration by clinical review or medical. I will continuously monitor the patient's oxygen level with an oximeter. I will look for patient progress notes and look for any PRN meds like salbutamol. I'll be with the patient until the patient condition is stable. Then I will follow up with my other patient who is diabetic. I'll follow up with the clinical situation. I will communicate with the staff member whom I have asked to look after. I will follow up with patient's BCL and I will look for a med chart and look if there is any insulin to be administered. And then I will document everything that happened during the shift in my notes. And also, I will not forget to do an ISBAR handover with other staff members as well. So, here in this situation, I'll be asking for help from other nurses as I believe in teamwork and I believe I'm a team player as well. Teamwork is very important in nursing to provide a patient centered care. Thank you.
Okay, that's a very good response. So now let's move into the second question. And the question is nurses must comply with their work health and safety standards. Describe a conflict situation you have been involved in your undergraduate nursing practice or as a nursing student. What did you do? What was the outcome? And what would you have done differently?
Okay, so I'll just give a brief description about work health and safety. So, work health and safety management system is a systematic approach to managing health and safety risks in the workplace and managing workplace incidents, injuries, or illness when they occur. Work health and safety includes infection control procedures, SARS disposal, clinical psychotoxic waste disposal, and safe manual handling, the provision and assessing of appropriate equipment, slips, trips and falls, spills and waste disposal, and vehicle selection and vehicle accidents, etc. Now, talking about a conflict situation that I faced while I was working, well, conflict is something that I always try to avoid. I try to avoid this by always communicating effectively with staff member. However, at times it is almost impossible to avoid conflict. So I have been working as AIN in the hospital since my second year of my nursing degree. So one of the situations I would like to explain today is when I was working as an assistant nurse in the geriatric ward. During my shift, all of my patients whom I was allocated to had COVID 19 and were in a single isolated room. During that shift, one of the patients was trying to get out of the bed, stating, I want to go out for a cigarette, and the patient was a high risk of fall and also was in isolation. So I was looking for my nurse to help me out to reposition the patient back to bed, but I was unable to find my nurse on the floor. Then I looked into other patient's room closely through the glass on the door. Then I observed that my nurse was in that room the whole time. I saw the nurse was talking with someone, putting on the airports in full PPE. This is a serious risk to the health and safety of the patient and other staff members as well. It breaches the dignity and respect of the patient and affected the other patients as well. Later, I tried to communicate with the nurse about this incident, but the nurse tried to deny the fact about talking on the phone inside the patient's room and was angry with me. We had a little cold discussion there. After a little one-to-one conversation, she accepted her mistake, requested me not to escalate this to anyone. At that time, I was a bit nervous about the situation. I thought like sometimes mistake can happen and I was not sure what to do. I was thinking, should I escalate this matter to the TL or no? I was in dilemma. I was a bit emotional at that time. And then I just explained to her, the nursing staff, not to do any kind of things, as it is an unethical practice as a registered nurse to do so. Now I look back onto it, I do think I should have escalated this issue to my TL or any registered nurse, as this is a breach of patient's privacy and dignity, and let my senior nurse take a decision rather than keeping things within myself. I do regret my decision in that clinical scenario.
Yeah. Hopefully you might have learned something. Maybe you will just follow and escalate the situation the next time if it happens, isn't it?
Yeah, I think I will do that
Okay.
in near future.
So yeah, so let's move into the last and final questions. So the question is, the completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a time of lifelong learning and autonomy. After obtaining employment, what is your short term, that is within the next 6 months to 1 year, and long term, which is within 2 to 5 years career plan and commitment to professional development? Do you want me to repeat the question, Durchana?
Fine, and thank you for the question. Yeah. Yes, I do believe that completion of my bachelor's degree is only the foundation of my development as a professional nurse, as nursing profession requires strong commitment, long-term and regular education, skills and ethics to work as a registered nurse. I'm sure that ahead of me, there is a lot to learn and explore, as nursing as a career is diverse and there are so many fields and settings that you can work in. After getting employed as a new graduate nurse, my short term goal will be to focus on my professional development and work full time for 1 year as a new graduate nurse. Some of the things that I will be doing are like attending in services, allocating study days for new graduate programs, keep up to date with evidence based research to guide practice, seek feedback from colleagues and senior staff, reflect on my own practice, and recognize areas of improvement, utilize support available, take advantage of every learning opportunities, and also to maintain my CPT points. Hence, these are some of my short-term goals for the next 6 months to 1 year. Now, well, talking about my long-term career plan and commitment to professional development, I do believe that doing what you love is very important to be a successful and happy person. I always love the idea of being a mental health nurse. So when I was on my clinical placement, I enjoyed my mental health placement a lot. I love the whole thing about dealing with people's emotional health rather than physical health. Personally, I like interacting and connecting with people. So while working as a mental health nurse, talking and interacting with patients is also a part of job. So therefore, I want to do a mental health nursing in future. And after finishing my new graduate program, I will be studying for a master's degree or postgraduate degree in mental health. I would like to do a specialization in mental health. My future goal is to become a clinical nurse specialist in mental health. I also know that to achieve all of my goals, one thing I must do is work very hard and be focused on my goals. And I'm looking forward to this new experience as a new graduate nurse and becoming a clinical nurse specialist in my near future. Thank you.
All right, so that's a very good plan. Okay, so that's the end of the interview. And do you have any questions to ask?
Uh, yeah, I just want to ask, when can I hear back from the interview?
So yeah, we will. I have no any idea. Maybe within the next 2 weeks, we will send to you an email. Okay.
Okay, yeah, thank you. Thank you for your time.
That's okay. Thank you for coming for the interview, and I wish you a very good luck.
Thank you. Thanks. Bye.
Bye.